Hello, hello everybody, and thank you so much for tuning in with us to our live virtual CoolSculpting event today. My name's Aubrey and I am the body contouring specialist here at Brooke Nix Medical Aesthetics. This is Allie Snyder. She has graciously agreed to be our model for our CoolSculpting event today. So Allie, if you want to go ahead and pop this robe off, we're going to go ahead and get started, go through a full assessment, what it looks like to get treated, and then a few before and afters and some frequently asked questions. Thank you so much. Alrighty folks, so first and foremost, Allie and I have already done a brief consultation on what her goals are with CoolSculpting, and I'm just going to review that very quickly with you today. So Allie here is 1 year postpartum. I know you can hardly tell, but there are a couple stubborn pockets of fat that she just really wants to go in and kind of debulk and help sculpt back to that pre-baby body that we all want, of course. So, Allie, if you will go ahead and turn to the side here, I'm going to show everybody kind of what we're looking at assessing. So for Allie, we're looking at bringing in a couple of these little stubborn pockets of fat just to eliminate some of that volume that she feels like she has from the side, which is absolutely achievable with CoolSculpting. Before we start that process, I am going to go ahead and just get a couple before and afters of Allie and just kind of go through that whole process with you as well. So Allie, if you wouldn't mind just stepping over to that platelet. Alrighty folks, so the importance of before and afters is vast when we're doing CoolSculpting because we really want to make sure that we can track progress not only before and after, but during the process as well. So Allie, if you will go ahead and just put your arms out in a box for me. Great. I'm going to have you take a very large deep breath in and breathe all the way out. Beautiful. If you'll rotate to those twos, take another large deep breath in for me and breathe all the way out. Excellent. And to those threes, large deep breath in and all the way out. So you can see what I'm doing here is just identifying not only where she sits naturally, but also just what her tissue looks like at a completely rested state. Excellent, and all the way out for me, Allie. And if you'll just come back and face me. We want to do this from every possible angle, so that way there is no chance that we are missing any natural asymmetries that we may potentially have, and we can really see what the treatment has done from every angle that we have treated. Perfect, Allie. And we're just going to do one more, facing those threes again. Big deep breath in and breathe all the way out. Amazing. Thank you so much. Okay, folks, so first thing I'm going to do here is I really want to identify what areas bother Allie, but also how we can sculpt her body to accent her natural shape. So if you take a look here, Allie has a really beautiful, and if you'll pop your arms out for me, Allie, a really beautiful natural hourglass shape. When CoolSculpting, it's not always about what I permanently take away, but it's also about what I leave behind on her body. So I want to keep that in mind as I'm choosing how to sculpt and accent that small of her waist and that really pretty hourglass shape that she already has. So let me go ahead and show you how I would do that today. First thing that I'm going to want to do on her abdomen is identify the border of her abdomen. So essentially what we're looking for is where she flattens out. So the best way to see it on Allie is if we turn her to the side, and we can really start to see where she's getting that little bit of shadowing right in here. So really and truly, that border starts to identify itself right through here. And if you can see what I mean, we've got that really pretty small of her waist, she flattens out, and then this is where that tissue begins to present itself. Allie, turn back that way for me. And we're just gonna do the exact same thing on the other side of her abdomen. Perfect, and then if you'll just come back to the middle. So now that I've identified those borders, the first thing that I'm going to want to do is identify those pockets of fat. So we're going to go in and we treat what is called subcutaneous pinch fat on the tissue. So I want to look to see where Allie is presenting those peaks, or essentially the of tissue. So for her, I see that she peaks right around here. And again, if we slightly turn her to the side, we can see right there is where that peak presents itself. So I'm going to take a look here. And because we want to accent that small of her waist, I'm going to make sure that I'm orienting everything right up to the small of her waist. So we're going to see how that tissue pulls and begins to taper off right at that border. So you can see where the bulk of that is versus where it really just turns into skin. So I'm going to identify that border here. I'm going to do the exact same thing right around here. The next thing I want to do is take my applicator template. Each time I place this template to Allie's body, it is going to be considered a treatment. So if I go in here and I position that right over the bulk, essentially where we're going to get the most pull with that applicator, the best part of the treatment, where that densest part of the fat is going to be right in there. And as you can see, it falls perfectly on that border and on that taper line that we've already identified. So we're going to go in and know that this is going to be our first area of treatment. Fantastic. How you doing, Allie?
Great.
Great. Okay. Now the beautiful thing about CoolSculpting is that we really do have such a fantastic level of artistry that we can add to her abdomen and to sculpting that body. So what I want to do next is go in and just finish marking on that abdomen. And Allie, you're perfectly fine if you just want to place your hands behind your back. So here, one thing that I always like to identify on patients is some potential natural asymmetries. We're humans, our bodies are imperfect, and so asymmetries are very, very common. On Allie specifically, we don't have very many asymmetries on the abdomen, so it's not something that I have to accommodate for today, but it is something that I always want to try to identify to